Josie, could we begin just by you could introduce yourself?
Okay, my name is Josie Smith and I am Head of Substance Misuse for Public Health Wales.
And you joined us here today for an event that's marking International Overdose Awareness Day. And in a slightly wider context, the things we have going on at the moment are a record number of drug deaths announced this month in Scotland, again, unfortunately. And a few weeks before that, the government announcing the notion that there would be a refresh of the current drug strategy, the road to recovery. So I suppose my big question to you, which is maybe unfair, but as somebody who's in Wales and observing this from afar, but experiencing some stuff in Wales that maybe has a parallel, what should we be doing with that strategy? What would the main thrust of a revised or a refreshed strategy be? And what would be the intended consequences of that?
I think certainly from a perspective outside of Scotland, I think that the emphasis on and even the language that's used within the title and the strategy itself in terms of focusing on recovery perhaps has inadvertently meant to others that the aim is abstinence. And from our perspective in Wales, and I think it's a very pragmatic approach, is a recognition that recovery may, in fact, for some, be a barrier. It is heavy on connotations, and I think that certainly language has never become as important as it is now. So in terms of moving a strategy forward, I think now we need to recognise that we are in a different situation in terms of drugs market particularly. We are seeing changes in drug deaths right across the UK, despite some really good interventions. I think that focusing on making those interventions as high quality as possible, and by that I mean full engagement with individuals who perhaps have historically stayed away from services or had some experience with services but choose not to currently engage because of expectation around abstinence or recovery. I think the provision of interventions that we know are effective and cost effective, high quality needle exchange, really high quality opioid substitute treatment for as long as is required, working with that individual on every element of their life that impacts on their drug use, as drug use, we know, may not be the priority for that individual at the time, and recognising that this is a process that cannot be driven by performance indicators alone or politicians' requirements, that this is a human intervention rather than just a drug intervention.
I mean, because today you were talking to us about people who aren't engaged with services. Actually, in your data, aren't engaged really with any services at all, including housing services, but aren't involved in treatment. And there's reasons for that. There's the people who we describe as hard to reach, who, of course, some of us are bumping into literally in the street. So it's not that they're actually hard to find in that sense.
No.
And there are so they're difficult to engage or whatever. But we also have people who we find it difficult to retain. Now, is that around us rejecting those people, or them not finding what they want in treatment? And so,
again, I think it's probably a combination of the two. Whilst we might have clear emphasis and our roles may be driven by the policy direction at the time, that too is translated in individuals and workers' attitudes, expectations, and by extension the attitudes and services that are offered to service users. If an individual is seeking very low threshold, very early toe in the water, kind of seeking help, and is faced with a very clear, structured approach to this is how you will recover, you've lost them.
Yeah.
Likewise, if the expectation, and they do engage, the likelihood of retention is lower. I think we really need to go back to grassroots, and in Wales certainly we're undertaking a process of evaluation of our existing harm reduction strategy, and it's very clearly stated in the title, and looking at what has worked and what has worked well and what has not worked so well, and the reasons behind that. And I think that, you know, evaluation is very important, but the title in and of itself in Scotland is a very clear direction of travel. And I think certainly the last 10 years the evidence from last 10 years has borne out that actually this may not be the right road, and that we really need to look again at how we engage, why people are using drugs, what are the circumstances of their wider life. We know we're in different times politically, economically, and we need to develop services in accordance with the current climate, which is more challenging than it has been for a number of years. I also think that we really need, and a very key part of the strategy is to re-educate a lot of individuals who have perhaps come into the substance misuse field in the last few years, and really take that back to grassroots, back to a human rights approach to provision of drug services, and engaging with individuals where they are at their own pace, rather than that which is driven by funding and policy and politicians.
Yeah. Well, thank you for that insight and those thoughts. We'll keep in touch and update you where we are.
Lovely.